Hello guys, Dr. Qureshi here, and today's topic is going to be the difference between Pinguecula versus Pterygium. And the reason I'm making this video today is because a lot of you have asked me in the exam room to differentiate between the two conditions and also to tell you or give you more information regarding these two conditions. So just as a brief background, Pinguecula and Pterygium can appear in anyone's eyes because of chronic exposure to sun rays. As we were growing up, I don't think all of us were used to wearing sunglasses, so our eyes got really exposed to the damaging UVA and UVB rays. And that resulted in a condition known as a pinguecula, which appears in the white part of the eye, which is in the conjunctiva area. A lot of people have that. If you do not protect your eyes with sunglasses, it can progress. It can become bigger and bigger. It can get inflamed and it can cause redness and irritation and maybe even discomfort. It can get inflamed, and that condition is known as pingueculitis. When that condition appears in the white part again in the conjunctiva area, then we have to treat it with the help of obviously artificial tears to keep the eyes lubricated, and also with the help of steroid drops such as Predforte or prednisolone acetate 1%. It can decrease or calm down the inflammation part of the pingueculitis. So the root cause of the problem would be pinguecula, and if it's not going away, or if you're not protecting your eyes with sunglasses, if it's progressing, then it can lead to pingueculitis. Because why does inflammation happen? Because of any kind of irritation. The back part of your lid is going to rub against the pingueculum. Pinguecula is the plural of pingueculum. Pingueculum is the singular. So if there is a pinguecula, it's obviously elevated, it's raised. The back part of the lid is rubbing against that surface every day. Every time you blink, it's rubbing against it. It causes irritation. Irritation leads to inflammation. And then it becomes obviously bothersome for the patients because A, it's hurting, B, it's looking bad, and it's causing that redness effect in their eyes. And obviously, because of the pain, we have to treat it. Now, if you do not protect your eyes with sunglasses and your pinguecula starts growing more and more and more, or gets bigger and bigger, then it can lead to a pterygium. Pterygium is the stage where it starts covering the cornea also. So in layman's terms, I like to explain things in layman's terms because there's a lot of you who are not accustomed to these medical terms. So in the layman's terms, it would be the white part of the eye is where the pinguecula starts, which is a minor thing, and then if it becomes major or if it progresses, then it can lead to a pterygium. Pterygium is when it involves the color part of the eye. So now you can know the difference, and I'm going to show you a picture in just a second also. So once it becomes a pterygium, it covers the cornea. And then it becomes more advanced if you again are protecting your eyes with sunglasses. At that stage, if it's covering the central part of the cornea, which is in the central part of the pupil or in the visual axis, then it requires surgical removal. Why? Because it's going to start affecting your eyes. Imagine something is sitting right in front of your eyeball. It's going to start causing difficulty in driving, watching TV, looking at things far away, because it's like sitting right there in the center of your eye. So if it encroaches onto the visual axis, then we have to get it surgically removed. Now, the surgical removal, obviously, it's good to get it removed, but it can have some complications also. Some of the complications would be, well, it can come back, it can reappear. And patients don't like that, obviously, because their insurance paid so much, and now it's coming back in their eyes. Number two, it can leave a scar also, because remember, the cornea is that area of the human eye which can leave scars very easily. Even when I remove foreign bodies, like metal foreign bodies from the cornea, even if I put the patients on antibiotic and steroid drops after removal of the foreign body, it still leaves a scar, which is known as subepithelial corneal scar. So just like that, the pterygium surgical removal can also result in a scar formation. And because of the scar, sometimes the vision is still affected because it depends on where it is, on what part of the cornea it is sitting on, or what part of the cornea was involved in that process. So having said that, we're going to summarize everything in just a bit, but I want to show you this beautiful picture because I know you guys like pictures and you learn from pictures. So if you look and just follow where my pen is pointing, this is the healthy eye, okay? The healthy eye obviously does not have anything going on. It's a beautiful, healthy eye. Now if you look at the pingueculum right there, This is the little fleshy growth you see on the white part or on the conjunctiva. This is known as pingueculum right there. So this is the pingueculum, and it's on the white part. So it hasn't involved the colored part yet. This is from chronic exposure to sun rays. And then if you look at the pterygium photo right there, look how big it got, and now it's involving the colored part or is coming onto the cornea. And if it comes in the center part of the pupil, which is known as the visual axis, then it will require surgical removal. Because why? Because the patient cannot see well. It's obstructing the field of vision, or is obstructing the vision or visual axis, and therefore the patient cannot see well. And that's required. This is where the patient is asked to go for surgical removal. Okay, so going back, let me move this camera a little bit. That's the healthy eye. No pinguecula, no pterygium. This is where the pingueculum is sitting right there. So that would be nasally. Nasal means that it's sitting towards the nasal area or nasal side. And this is the pterygium. Again, it's nasally, so it's sitting towards the nasal side. Or it could be here also. It could be here, so it could be nasal or temporal. It could be nasal or temporal. So now you know the difference. This is pingueculum that I talk about in the exam room a whole lot, and this is the pterygium that I talk about in the exam room a whole lot. And at this stage, I can tell you more about what to do. Okay, so I always tell my patients, well, you need UV protection. That's when I talk about sunglasses a whole lot. And if you know me from all the videos that I've posted over the years, you know I'm big on wearing sunglasses because I believe in protecting the eyes from UVA, UVB damaging rays. It's important to protect your eyes as far as macular health is concerned. So macula is a very sensitive area in the back of your eye, in the retina. And then again, protect your eyes so that you do not develop pinguecula and pterygium and you do not end up having inflammation. So for the treatment, now if the pinguecula is sitting there and is not bothering you every time you come for a routine eye exam and I monitor your eyes, then I can just say, okay, just protect your eyes with sunglasses. But if it starts bothering you, like if it starts getting inflamed and leads to pingueculitis, that's the time when I recommend prescription eye drops, which is Pret Forte, prednisolone acetate 1%, 4 times a day for 2 weeks, 2 times a day, third week and final week once a day. As you know, I taper my corticosteroid drops. So that would be Pret Forte, and you have to shake the bottle well as always, and that's going to calm down the inflammation. But like as you know, I do not recommend steroid drops for long term because of the potential side effects that can happen. So I would also start the patients on a dry eye drop, such as it could be a Refresh artificial tear, or it could be Sustain, or it could even be a prescription drop, depending on if they have dry eyes and if they need a little bit more advanced or extensive treatment versus just over-the-counter treatment, if that makes sense. So I can start them on over-the-counter lubricating drops along with the steroid drop, and if they have dry eyes, then I can do a Sequa or a Xiidra or a Stasis twice a day and see how the condition improves. So it could be dry eyes associated with pingueculitis. But just for the pingueculitis, I would just go with steroid drops and then an artificial tear over the counter. Again, the ones that I recommend is something that you need to follow because as you know from my videos, there are so many bad eye drops over the counter. So just always listen to your doctor. Then when we talk about the pterygium, and let's say the patient comes every year and I see the pterygium is sitting nasally, like more towards, it's not sitting in the center part of the pupil. So then I would say, okay, I'm going to monitor it and I'll see if it's progressing. I will definitely take measurements of it, make a note of it in the chart, in the exam notes, and continue monitoring it. Now, if it starts bothering the patient and I notice from my clinical perspective or from my exam perspective, if it's coming into the center of the eye or in the visual axis, then I can recommend surgical removal because that's the time when the insurance would consider that a necessity, a medical necessity, because if it's encroaching onto the center of the eye, then it needs to be removed, obviously, because it's going to be a hindrance in driving or seeing things far away, especially when you're driving. So when you are going for the surgical removal, like I said, it can leave a scar, it can come back also, and a lot of times it doesn't come back, and patients are very happy with the outcome and with the result of the surgery. So those are the three things, and let me just show you one last time my photo again. Healthy eye, Pingueculum in the middle, and Pterygium in the corner, the third picture. So healthy eyes, Pinguecula, and Pterygium. So take a good look of it, and you would know when you come back next time, you would know what I'm talking about when I keep saying, oh, you have a Pinguecula, oh, you have a Pterygium. So that's all about these two conditions. Protect your eyes with sunglasses, and you have a great day. Bye-bye.